This is Sally. She is being treated for breast cancer, and her oncologist just started her on two medications, Ibrance and Letrozole. When she gets to the pharmacy, she finds out that one of the medications requires something called a prior authorization. Sound familiar? That's because almost every cancer medication is considered a specialty med and requires this prior authorization process. Most cancer medications are expensive and are not something insurance companies like to pay for. Insurance companies have a list of drugs that they cover, also known as a formulary. A review of most insurance company formularies has a common theme. Cancer medications require what is called a prior authorization, or PA, also known as pre-certification, prior notification, or prior approval. Whatever you call it, this means that your doctor must explain why you need a medication before your plan decides how and if it will be covered. So what can you do about it? When your oncologist prescribes a medication, double check on your insurance plan's formulary to see if it requires a PA. This can be found on the website for your health plan. Work with your health plan and your provider to try and get the medication approved. Oftentimes, they are dealing with requests for a large number of patients. It is important that you make yourself a priority to move the process along. So Sally gets on the phone with her doctor's office, and the prior authorization is finally approved. So insurance pays for the drug now, right? Well, not exactly. So even if you've been paying your health insurance premiums and after meeting your deductible, many cancer medications still have a copay or coinsurance. Welcome to the American healthcare system. More on that in another video. A copay is a fixed amount an enrollee must pay for a doctor's visit, prescription drug, or other type of medical care. Say $25 each time you visit the doctor or pick up a prescription. Coinsurance is a fixed percentage an enrollee must pay for the cost of care. What you end up having to pay can vary depending on the type of drug, your insurance plan, and the pharmacy where the drug is dispensed. For example, coinsurance percentages for cancer drugs can be quite high, typically up to 20% or more. This means that Sally could end up being responsible for $3,400 or even more. Crazy to think that someone with insurance still needs to pay that much. So is there anything we can do about it? Sadly, there are a lot of problems in our healthcare system that need fixing. Thankfully, there are resources and strategies to help with cost. Drug manufacturers typically offer programs or copay cards that can help cover the cost. You may be wondering, why would a drug manufacturer charge so much for a drug only to offer cards to cover the copay? Well, the truth is, it's complicated and many people need to get paid. More on that in a future video. Some cancer drugs can come with a lot of side effects. When therapy is first started, it is not uncommon for dose adjustments or even discontinuation of treatment if patients cannot tolerate the drug. There is an estimated $3 billion of cancer drug waste in the United States every year. To help prevent you from paying for drugs you don't use due to side effects, one approach could be to consider what is called a split fill. Instead of filling a full month's supply, some plans will allow for a split fill where 15 days worth of a prescription is filled twice a month for the first few months of treatment. This prevents you from paying for a full month's supply of medication if treatment or dose is changed. Just be sure to check that the plan allows for this and will not try to charge more in copays or coinsurance. After some time, when tolerance of the therapy is confirmed, a patient could start getting a full month's worth of therapy at a time. Another thing to consider would be the timing of when prescriptions are filled. Response to therapy is usually assessed at your doctor's appointments. It is not uncommon for changes in dose, directions, or treatment plan based on how you are doing. Filling a prescription right before a doctor's appointment could lead to waste if therapy is changed. Being aware of when appointments and prescription fills are scheduled is a good thing to keep track of. Just make sure not to cut it too close and risk running out of medication. Even with our best efforts to minimize drug waste, it is sometimes unavoidable. There are opportunities to recover and redistribute cancer medications through something called drug repositories. These repositories allow eligible, unused medications to be donated and redistributed to patients at no cost, as long as they follow specific guidelines established by each state. Legislation permitting prescription drug repository programs has been adopted in many states. Individual state programs vary and are definitely something to look into. In 1992, the U.S. federal government created the 340B Drug Pricing Program, which requires drug manufacturers to provide outpatient drugs to eligible healthcare organizations at significantly reduced prices. These organizations were meant to serve low-income or uninsured patients. To find out more information about hospitals that are part of the 340B program, and if you qualify, you can visit the Health Resources and Services Administration website or 340B Health, a nonprofit organization that supports the 340B program. Links to the websites will be included below. Another possibility that some cancer treatment centers offer are patient financial assistance programs. These are usually income-based and require an application. However, if approved, this could mean the hospital paying for parts or all of the bill not covered by the insurance. Check with your local treatment centers to see if you qualify for such a program. Does learning all this make you frustrated and overwhelmed? It does for many patients, just like Sally here. But before taking it out on the pharmacy staff, please remember, it's become a messy and overly complicated system with no easy solution. Thankfully, Sally is able to use a manufacturer copay card to fully cover her copay and get both her prescriptions. Hopefully, the topics and strategies discussed here can be helpful for you or a loved one receiving treatment. Please share with anyone you think this will help. Thank you, and until next time.